Heparin is one of the most commonly used anticoagulant in hospitals, but many people get confused between unfractionated heparin and low molecular weight heparin. In my previous video, I explained the different dosage forms of heparin used in the clinical practice. If you haven't watched the video yet, I strongly recommend watching it first. In today's video, I will clearly understand the difference between unfractionated heparin and low molecular weight heparin, their mechanisms, dosing, monitoring, advantages, disadvantages, and clinical uses. What is the unfractionated heparin? Unfractionated heparin, or UFH, is the traditional form of heparin. It is heterogeneous mixture of the large polysaccharide chains with high molecular weight. Unfractionated heparin works by activating antithrombin, which is endogenous anticoagulant that is naturally occurring in the body, which in turn inhibit activated factor 2, thrombin, and activated factor 10, as well as activated factor 9, 11, and 12, and plasmin, and thus preventing conversion of fibrinogen to fibrin. Because of its variable chain length, the anticoagulant effect of unfractionated heparin is unpredictable, which is why it requires frequent monitoring. Let's see what is low molecular weight heparin. Low molecular weight heparin are derived from unfractionated heparin by controlled depolymerization. Examples include enoxaparin, dalteparin, nadroparin. Low molecular weight heparin mainly inhibits activated factor 10 with minimal effects on thrombin, that is activated factor 2. Because of its smaller and more uniform molecules, it has a more predictable anticoagulant response, making routine monitoring usually unnecessary. What are the key differences between unfractionated and low molecular weight heparin? Their molecular weight. Unfractionated heparin has a high molecular weight and wide size variation. Low molecular weight has a low and more uniform molecular weight. Mechanism of action. Unfractionated heparin inhibits both activated factor 2 and activated factor 10 equally. Low molecular weight heparin predominantly inhibit activated factor 10 and has less activity against thrombin. Third, route of administration. Unfractionated heparin can be given intravenously or subcutaneously, but low molecular weight heparin is given only by subcutaneous injection. Fourth, monitoring requirements. Unfractionated heparin requires a regular monitoring using activated partial thromboplastin time or anti-activated factor 10 level due to its unpredictable response. Low molecular weight heparin generally does not require routine monitoring except in special populations like pregnancy, renal failure, or external body weight. Fifth is half-life. Unfractionated heparin has a short half-life, so continuous infusion is often needed. Low molecular weight heparin has a longer half-life, allowing once or twice daily dosing. Sixth is the risk of bleeding and HIT, which is heparin-induced thrombocytopenia. The risk of heparin-induced thrombocytopenia is longer with unfractionated heparin. Low molecular weight heparin has a low risk of HIT and bleeding, making it safer for long-term use. 7. Use in renal impairment. Unfractionated heparin is preferred in renal failure as it is not primarily cleared by the kidney. Low molecular weight heparin is renally excreted, so dose adjustment or avoidance is needed in renal impairment. Now let's see their clinical uses. Unfractionated heparin is commonly used in ICU patients during surgeries, in patients with renal failure, when rapid reversal of anticoagulation is required. And low molecular weight heparin usually used in deep vein thrombosis, pulmonary embolism, post-operative thromboprophylaxis, or outpatient anticoagulation therapy. Now let's talk about reversal agents. So protamine sulfate completely reverses unfractionated heparin. For low molecular weight heparin, protamine provides only partial reversal. That is, protamine sulfate acts as an antidote for overdose of heparin. Understanding the differences between unfractionated heparin and low molecular weight heparin is extremely important for safe and effective patient care. If you found this video helpful, like the video, share it with your friends, and subscribe to the channel for more clinical pharmacy content. Thank you for watching, and I will see you in the next video.